With the numbers increasing by the thousands a day, many of you have contacted me concerned about the fact that we're seeing so many more patients with COVID ID right here in Michigan. Joining me now to answer your questions and give us a little bit more perspective on this is Dr. Patel, a pulmonologist currently working with North Ottawa Community Hospital. Thank you so much for joining us today. Rapid testing is about to hit Michigan. So what does that look like in numbers? What are we going to begin to see now that rapid testing may be available soon?
So rapid testing allow us to have a positive results in as little as 5 minutes. So what will this do is it will increase number of cases, because normally we wouldn't be testing a lot of the patient, but now as you test more, you will have more and more positive cases. However, this also means that we will isolate some of those positive cases, so therefore we can stop the spread of the disease. And overall, this will be good for the system. This is something that South Korea and Singapore did, where they went out and did a lot of testing, and hence they had overall much less mortality, and they essentially got control of the viruses sooner than many of the other countries such as Italy or Spain.
And so just because there will be more cases, it does not mean that there will be more hospitalizations.
Probably not. And also you have to know that these are the cases that we're testing them, which we wouldn't be testing that if we didn't have this rapid testing available. So it's not necessarily more cases, it just means more known or more detected cases.
Because the virus is here, and we know that there are a lot of people that may be carrying it and just simply don't know.
Exactly. So approximately 80% of patients, as we know, are either with mild symptoms or asymptomatic, and they're likely spreading the disease. But if we have a rapid testing available, it will be easier for more people to get tested. Hence, we can isolate them.
Now, if somebody should have to go to the hospital or have a loved one that goes to the hospital, what does that look like for them? Are they going to be completely isolated, not being able to have family? Are they in their own room? What is that experience like for them?
So the first different experience they might notice is if we have more and more cases with corona, they might see hospital staff wearing masks or gowns, and that might be a little different for them. We do expect the numbers to increase in a near future. We are a small hospital, but we're very much prepared for it if this does happen. As far as visitations are concerned, there might be limitation on visits depending on how things go. How many patients you have in the hospital, and how many of them are going to be with COVID.
And then do we know whether or not they'd be in like a single room or a double room?
Yeah, so I initially we will provide them private rooms, but if there is a need for more beds, we can put 2 patients in a room, especially on the floor.
Okay. Well, thank you so much, Dr. Patel, for giving us a little bit more perspective on rapid testing, what that means for West Michigan, and the care that the patients will be receiving. If you would like more information on COVID-19, we have a special link for you on our website.